Dr. Dawe is our first speaker, and he is the Program Chief and Medical Director of Mental Health at Trillium Health Partners in Mississauga, Ontario, and a Professor of Psychiatry at the University of Toronto. Working in collaboration with Trillium's senior leadership team, its service users and their families, as well as its medical and allied health professionals, is focused on co-creating a new kind of addiction and mental health care, one that prioritizes personalization, coordination, and enablement. He recently served as the chief of the Ontario Hospital Association's Suicide Prevention Standards Task Force, a diverse panel of researchers, academics, clinicians, and lived experience experts with a mandate from the Minister of Health and Long-Term Care to focus on establishing best practice, evidence-based standards to guide the care for at-risk people in all of Ontario's 151 hospitals. He has acted as principal co-investigator in clinical trials and has authored numerous articles and reports on mental health care. He is a frequent invited lecturer with the Bell Let's Talk campaign on topics including suicide prevention, mindfulness, interprofessional recovery-oriented care, and workplace mental health, and has presented his findings at a wide variety of provincial, national, and international seminars, conferences, and symposia. Dr. Dawe completed medical school at Memorial University in Newfoundland and a residency in psychiatry, 2 years of fellowship training in suicide studies, emergency psychiatry, and mental health systems research areas and a master's degree in health administration, all at the University of Toronto. His clinical research areas of interest include recovery, telemental health and virtual care services, suicide and suicidal behaviors, quality and patient safety, health advocacy, and the design and evaluation of mental health delivery systems. He has 3 children, a wonderful committed partner, but yet somehow he remains an avid golfer. I must say Dr. Dawe is a very well-credentialed physician, and some of his accomplishments were left out in the interest of time. I now call on Dr. Dawe to present.
Charles, thank you so much. You read that just as my mother wrote the bio, so she's very appreciative of you saying so. And thank you, guys. It's an honor to be with you here today. I'm going to share my screen so that we can get started with the presentation. And really, it's nice to be with you again. I had the honor of co-presenting with you guys at the Walnut Foundation in a previous Movember presentation about men's health and men's mental health. This time we're going to focus specifically on men's mental health and coping in the pandemic, because as you well know, this is an unprecedented time. In human history, it's an unprecedented time in stress and distress in our populations. And today, you are going to hear a number of different perspectives on wellness. I'm honored to kick it off from the mental health side of that construct. So I guess some reality to get us started. Here are the case counts of COVID-19 as of yesterday. This is hot off the press here in Ontario. And you can see there are still significant numbers of people contracting the disease and dying by this disease every single day. 1,670 new cases yesterday in Ontario, 45 new deaths. The graph underneath kind of illustrates the confirmed case counts over the last week or so. They have come down because of the significant efforts you are all making to keep yourselves safe and keep yourselves healthy. but we can't let up now. It is a very dicey time still. It's a really dicey time, particularly here in Peel region. You can see Brampton, Peel, Caledon, Mississauga up here at the top on these graphs are the hot spots in the province of where this disease is striking our friends, our neighbors, and our families. We need to be vigilant, cautious, and take action for our health as well as the health of those around us. And you've probably heard over the year, because this has been with us almost a year now, the various waves of the pandemic, wave 1, now kind of wave 2 or 3. This is how I tend to think of the various waves from a mental health standpoint. It's a slightly different type of process. Wave 1 very much was about the immediate mortality and the morbidity, the death and the sickness related to the disease itself. For me, wave 2 was about the impact of everything that we did to try to get control of wave 1. Hospitals, healthcare organizations, physicians, providers, we all made really difficult decisions about redirecting priorities and redirecting resources to the fight against COVID-19. Non-essential surgeries were canceled. Chronic conditions became something that wasn't treated as effectively or as often. Resources were really flowing to meet the needs of COVID explicitly, and that continues now. Wave 3 is kind of the impact of that. First on the urgent stuff, and then more on the chronic stuff, the conditions that have been in people's lives for a long time. But for me as a mental health professional, it's wave 4 that is really the one of most specific concern. And that's the mental health impact, the psychic trauma of our collective experiences, the worsening illness in our population on a psychological capacity, the impacts of economic injury and burnout and distress, all of those things we know based on past epidemics and past disasters throughout the world. All of those things come later, come in a complex and challenging scenario, and we're seeing that now in our emergency departments. We're seeing that in our presentations to our hospitals and to our clinics. This has taken such a toll on the population and its mental health that we're really just feeling the impacts of it. And that impact is spread across the lifespan. You can see it throughout all aspects of our populations, whether it is in our kids, the isolation and the loss of connection to their friends, our kids in school or not in school at the moment, the impact of virtual learning, the stress, the boredom, the interruption of their learning, the challenges for all of us as working adults or working age adults. If we're still working, if we're working from the home environment and having to balance that work and home stress, the care stress that we have, the concern of getting the illness itself, the concern of passing on the illness if we do get it, and of course the impacts on our aged population as well, because they have been predictably and predominantly and tragically vulnerable to the disease. There was a report released last summer by Deloitte, one of the big consulting firms, that was really looking at the impact on Canada's vulnerable populations. And I think we all know, the community where we live, the community that I've chosen to practice in, has such wonderful diversity and a spirit of caring and helping for one another that dates back for ages. But we all do still appreciate, perhaps this month more than others, um, the systemic challenges and barriers that exist. Lack of access equitably to resources, to income security, to food security, to financial and job security. The challenges of racism and judgment and marginalization and disenfranchisement. All of those things are highlighted in how this disease has impacted us as a society. Now, specifically, gender inequality has been at the forefront of the inequality debate in this country for an awful long time. And COVID indeed has really kind of struck our female colleagues hard. In some respects, it's because the job losses relating to COVID have predominantly struck in the service industry and the hospitality industries, where women are predominantly employed. And thus the job losses related to those businesses shuttering or pausing have been there. But on the other hand, women at home, working or not, have also been shouldering the significant burden of looking after their child's education in the initial lockdown phase, in this resumption of the lockdown phase, when they're kind of both working and managing the virtual learning environment. And guys, I do not think we're giving the women in our lives enough credit for exactly how difficult that burden is. So as you think about it coming out of today, a shout out to those who are doing so much. Similarly, the older population is also quite vulnerable to income insecurity. And as governments have contracted spending or changed spending, as incomes, finances have been decimated, as businesses that people have worked their lives for have been shuttered, that is disproportionately impacted on our aged population too. Not to mention, of course, the tragedy of the deaths in the long-term care homes, the retirement homes, and the challenges. So all of this has a significant mental health impact on our population. Statistics Canada a few weeks ago put together this infographic, which was looking at how the disease impacts on Canadian families and what parents are concerned about. And you can see across Canadian families, the concerns are about balancing all of the various competing needs for time, managing children's behavior, their stress levels, their anxiety levels, their emotions, staying connected when in fact social distancing, actually a terribly named concept. It's not social distancing, it's physical distancing that we're talking about. But social distancing, the perception that we cannot be connected to those around us, is an incredibly damaging part to our psyche. When you look in more specifically to people's coping strategies, you can actually see some of the more challenging coping strategies emerging in the choices people are making. We call this maladaptive coping that might help us get through a stressful situation or feel better temporarily, but not necessarily actually solving the problem or helping to improve our health and stress management overall. And some of the challenges that you see here emerging are a net increase in substance use and gambling of 42% related to pre-pandemic levels, as people are struggling with the just overwhelming stresses that this last number of months has brought on us. So think about taking your own mental health temperature right now, because there are ways that we can measure how we are doing in our stress levels. Initially, as this pandemic first hit us in 2020, I think there was so many people who were really stuck in that fear zone over here on the left side of the screen. That's where, we were buying things and hoarding things and doom scrolling on Twitter and reading the news religiously. Our emotions were about fear, anger, disruption, uncertainty, and we were really struggling as a result. As we've gotten used to operating in that uncertain environment, hopefully and adaptively, what happens is our coping starts to move across the screen into the center and to the right. The learning zone is where we start to identify the emotions we're dealing with, learning that we've got to give up on what we can't control, become aware of what situation we're in and how to focus on acting in that moment. Not just spreading information, but evaluating the information before we think about it. And then the growth zone is how we can start caring for others in our lives. The volunteer work that you as a foundation continue to do, working for adaptive ways. And those are the tips that I wanted to end off in my part of the presentation this morning. What are those strategies that we can use to keep us moving across the screen to the right and moving to that adaptation? And there's a number of them. This is a checklist of things that we can do to look after our mental health. How do we deal with setbacks? I'm happy to make these slides available to you all afterwards. But it's things like, starting to think about things that we can do that contribute to our health. Writing things down, actually writing positive things down in our lives to both anchor us and ground us in who we are as people and what has been beneficial in our lives up until now. Building that support network, reinforcing that support network of others, identifying the things that are triggers to us and moving across them, things like that. Most explicitly, though, for today, I think it's about recognizing that anxiety and distress is part of what we should be feeling right now. It is a normal part of the human condition in responding to these unprecedented type of experiences that we're having. Most of us have never lived through a global pandemic before. It's not surprising that this is new for us, let alone the kind of economic downturn, the greatest single economic contraction across the world since the Great Depression of the 1920s. And now, in the US, you're seeing riots and the military in the street, and just incredible systemic inequalities of responses to unrest. It's a dystopian type of time. Hopefully, things have started to change in the U.S. now with the changing of the administration, but that is by no means something that happens overnight. And the challenges that have been ripped open, perhaps there all along, have resonance here in Canada too. So that uncertainty, that global feeling of insecurity certainly has impacts on us and how we feel we operate in our world. That's normal. It is understandable. It's not acceptable, but it is normal as a response to the type of scenarios that we're experiencing. What we need to do is to figure out how to respond to that in such a way that the anxiety, the distress, the uncertainty doesn't take over our lives and dominate our lives. How do we adapt to it? How do we respond to it? That's what we want to focus on. And there's a couple of things that we can do about that. Part of what I tend to concentrate on, I'm a psychiatrist, so we tend to work with a lot of people on the way that we are thinking. And challenging our worries and our anxious thoughts is an important part of the therapy that we practice on a daily basis with our clients. And it's what I want to encourage you to do for yourselves today. You might be thinking, in response to the stress and the distress that you're having, these really uncomfortable thoughts like, I'm going to get sick and I'm going to die, or I'm going to lose my life savings, or there's nothing that I can do. I'm not going to be able to cope with this. Those thoughts are anxious thoughts. They come from our fears. They come from a way of understanding the situations that we are dealing with. But it is incredibly important to remember and to constantly remind ourselves that not all of our thoughts are actual facts. Many of them are just worries and thoughts, and they come from the fears or the concerns that we've had for a long time. No matter how familiar they might be, it does not necessarily make our thought an objective truth. And once we're able to kind of separate from that and recognize, okay, this is a thought. It's a thought that I'm having because I'm scared or I'm uncertain right now. It allows us to back away from the thought and not accept it as truth and not accept it as necessarily what will happen. That allows us to kind of validate our experiences, to deal with that, to gain perspective in how we might thus handle it differently. Do not accept just because you're thinking something that it is that way, and it must be that way, and it will always be that way. By challenging our thoughts, we can then work on changing our thoughts and thus changing how we're going to feel as a result. And here's a kind of good example. Many of us are sending our kids back to in-person learning next week, and there's a lot of concern about what that's going to be. Is it a safe environment? What is happening? How are our kids going to be in that environment? That stress and anxiety can impact on our families, no matter how much we may want them to go back to school, because we recognize the downsides of them not being in school. It's that catch-22 point of distress. So as we try to manage that competing environment, it's important, I think, to acknowledge it, to talk openly with our kids that, this big thing is happening next week. You're going to be faced with it. Do you have any questions? Do you have any concerns? Get them to be able to feel comfortable to speak to what they are feeling. Don't assume that just because they're not saying anything about it, they're not feeling it. Or even if they say, yeah, everything's okay, I'm not worried, press them. Keep the door open to that conversation. When they do vocalize how they're feeling, it's also going to be important for us to not just reassure them, but to be genuine about how we go about reassuring it. There's a difference between kind of these blanket statements like, don't worry, everything's going to be okay, I'm sure it's going to be fine. Obviously, I'm kind of overemphasizing that, but think about the difference between hearing that type of statement versus hearing something like, I know it's distressing. We don't know what it's going to be like, but we can have confidence together that everybody is working in the best spirit of safety. Teachers, school officials are going to be trying their best to keep everyone safe. And we're going to work as best as we can in that spirit. That second type of theme is a more genuine encouragement of reality. And that can help our kids not just manage this type of stress, but deal with uncertainty in a realistic fashion going forward. Because honestly, we're never totally certain about what the future is at any time. When I work on Saturdays here at the hospital. So when I came to work this morning, was I completely certain that when I was driving here that a car wasn't going to veer off the road and slam into me in an uncertain environment? No, I wasn't completely certain about that. Was I sure that when I left the house and locked it, that somebody wasn't going to rob my house, knowing that I wasn't there at the moment? No, I'm not certain about that either. And I don't mean to be blithely talking about these conditions, but I want to be pointing out that we're faced with uncertainty all the time. And we make decisions and we operate our lives by balancing risk and by taking the appropriate precautions as best as we can. That is about managing risk. Because when we're faced with risk or when we're faced with uncertainty, there's kind of two choices we have. One, we can be overwhelmed by it and we can attempt to do everything possible in our control to eliminate it completely. We can learn, we can read. It's that doom scrolling that people talk about on social media. We're just learning and learning and learning and thinking about worst case scenarios all the time. Actually, that doesn't help. It actually promotes further uncertainty because it promotes this idea that we're never going to be able to do enough. There's always something that we're not thinking about. And that actually, despite our efforts to do it to help, it undermines us. Instead, think about again, taking the appropriate precautions as best as we can, but accepting that we're still living with some uncertainty, but that we've minimized that uncertainty within the bounds of our control. That becomes getting friendly with risk, getting familiar with uncertainty, because uncertainty is part of our lives. It is heightened right now with all of the things that I mentioned earlier that we're dealing with. But the principles of managing it are still the same. So talking with our kids, talking with each other, talking with our spouses, talking with our families, talking with our neighbors, appropriately distanced across the fence, of course. How do we go about that? How do we, as men who may not be necessarily comfortable historically sharing our thoughts, sharing our feelings, revealing our kind of insecurities or our vulnerabilities, how do we go about doing that? I think there's a couple of things, and here's another infographic just about giving some tips about it. It's about making the conversation safe, both for the person having it and for the person listening. It's about starting a conversation at one time and continuing it at another time. It doesn't all have to be wrapped up in a nice package in 10 minutes. It can take place in a start and stop fashion. It's about recognizing that having a conversation is not necessarily always about finding a solution or solving the other person's problems. Often it's just about communicating that we're concerned, that we're there, that we're listening, and that we care about that person. That's what offering support is. when we encourage people to be supportive of one another, we're not saying that you have to be somebody's therapist or solve all of their problems for them. Think about the analogy of CPR, cardiopulmonary resuscitation. If we walk past somebody in public who's dropped down and is having a heart attack, we have trained an awful lot of people in society who actually know how to respond to that, to do that initial life-saving intervention until the first responders arrive, the ambulance, the police, the fire department, who will take over and then bring that person for more specialized treatment. Having a mental health conversation is more like that mental health first aid. It's not being the professional therapist as much as it's just, hey, how you doing? Are you okay? How can I help? How can I support you today? Having that safe conversation is incredibly important for our own development, but also for the people in our lives who will hear us and who will feel supported by us as we do that. Now, as we wrap up my portion of the events, I wanted to leave you with a couple of thoughts too. You might have heard this word a lot, resiliency. And resiliency is, it's an easy thing to say, but it's a tough thing to do, and it's a tough thing to maintain. You can't just tell someone to be resilient, because often the things that we have relied on in the past to overcome adversity, which is essentially what resiliency means, the capacity to overcome adversity when faced with it. The things that we've normally used have been disrupted by the pandemic. Our identities, our jobs, our income, the security of our family life, all that stuff has been disrupted right now. So asking people to just be resilient when the very basis of their resilience has been disrupted has been a challenge. But for my mind, and in my experience with people over the last 20 years, resilient people have a couple of characteristics. One, they've got an incredible ability to improvise. When faced with a situation, they don't necessarily just respond to it one way. They can think of multiple ways to handle any particular problem. And they have an incredible ability to accept a situation without judging it, without falling into the trap of bringing a judgment on the impact of that situation or why it's happening or what it means. They just say, okay, here's the situation. What do I do about it? So the fight doesn't go in resisting the situation or not accepting the situation. The energy in the fight goes into, what do I do about it? And that is the hallmark of true resilience. And I wanted to actually touch on 4 things at the end here to encourage and leave you with as you work on building your own resiliency back up again, because it's likely been bruised in the last 11 months. First one is hope. Hope is what drives optimism about tomorrow. This is a human characteristic. It goes beyond culture, it goes beyond nationalism, it goes beyond society. It is a humanness characteristic. And it might be hope of the future of the individual, of the future of our family. It reminds us that we can shape our future, that things won't be this way forever. And it reminds us that we're living amongst a community. Events like this morning and the work that Ken reflected in his introduction to the conversation about the power of community, the power of working together. That's driven on the basis of hope. So for those of you who are not feeling particularly hopeful right now, try to find something to focus on to be hopeful about. Whether it is the opportunity that will present itself post-pandemic, the opportunity to rebuild or refocus on things that might not be the way we wanted them to be, but provide us an opportunity to make the difference. Oops, sorry, I went backwards there. The second characteristic is belonging. And belonging is another incredibly important part of resilience in being human. And as we start to heal ourselves, these are the things to focus on. Connectedness, relationships with family, with community, with nature, a sense of belonging, to know that we are not alone. I mentioned this a few minutes ago now, that how terrible the social distancing name was to our initial public health interventions, because social distancing seemed to suggest that belonging didn't matter. And belonging really matters. That's why it's a constant reminder. Our language should be physical distancing, not social distancing. We need the social connectedness. We just need to be physically distant. Purpose. Purpose is the third thing that I want you to think about for yourselves, because purpose creates so much for ourselves. An understanding that everybody is important. The physical body is the heart of spirit, of mind, the interconnectedness. We must have purpose in our lives. We've got to have a reason for doing what we do. That reason for living gives us resilience in the face of challenges. It provides us that broader perspective of who we are, why we are. If your purpose has been disrupted by the pandemic, find another one, rebuild it back up again. This is the key part to being a productive person for ourselves, for our families, and for our communities. And finally, related to that, meaning, the attitude towards living. Sometimes we can get caught up in thinking that the meaning is superficial, that it has a lot to do with the stuff that we have in our lives. We can define meaning differently, but never let anyone define whether life is worth living or not. It most certainly is. And of all of the things that we want to protect against, it is the scenario of hopelessness and the loss of meaning in people's lives, because that's what drives them to make unhealthy choices. That's what drives people to die by suicide, alone, in despair. And that is something that we can help each other as citizens with by finding our own meaning and reminding those around us what their meaning is to us. So wrapping up, there's a lot of things that we can do. You'll hear in the next presenters about how to care for ourselves in a natural way, how to make sure our finances are in check and in order as much as we can. How can we physically remain healthy during these times? And all of those things are reflected on an infographic here too. Staying connected, coping, managing, staying active, making sure we sleep, eat, rest. Don't abuse alcohol too much. Don't use marijuana too much. Don't overuse caffeine. Those basic core principles of our health are really important to our coping. And finally, be kind to ourselves. recognize this is an incredibly tough time. The strategies that I've outlined here, the strategies that you're going to hear about in the next little bit, they'll take some time to work. They'll take lots of practice. We don't learn foreign languages in a week. You know, we don't learn new learnings quickly. We learn it, we practice it, we do it over and over and over and over again. Then we look for the results. Don't hold yourself to, you know, trying something on a Saturday and because it doesn't work on a Sunday, throwing up your hands and feeling like it's never going to work. It will take some time, but that's okay. Don't be hard on yourself. You know, if you forget to do something, if you're not feeling better right away, trust it. Keep working at it. It will come around. There is no such thing as failing when we make good efforts like this. It's about doing the best we can under the circumstances that we have. So thank you, Anthony, Charles, Ken, for the invite to be with you this morning. It's a pleasure to share some of the thoughts about what I had on this topic. I really regret that I can't spend the rest of the morning with you listening to the remainder of the presentations. As I mentioned, I am actually in the hospital seeing patients this morning, so I've got a number of people waiting for me here. But I'm really grateful to have been able to take this time. I will share these slides with the group and the organizers, and feel free to distribute them. And I really want to thank you. I hope this is helpful for you, and wish you the best for the remainder of the morning.
Do you have time for one question at least?
Of course.
Someone put in the chat, there's a growing problem that I see amongst my peers. There's a rising tide of anger and frustration with the government and the rollout of the vaccines. Could this be the fifth wave?
That's a great question. You know, I think the rollout of the vaccines is a challenge. We thought we were getting more than we got. We're making decisions with a limited supply. And I think that there was a sense at that beginning, and I'm not justifying any of the commentary that we heard, but I want to believe that there was in these initial communications that there were going to be millions and millions and millions of doses of vaccines made available. Hope and a spirit of wishfulness to it. But what I think people haven't appreciated is that, generally speaking, vaccines have taken years to go through the processes and to be developed. This one has actually hit in light speed. We are way beyond where any of us expected to be with a vaccine distribution from design, testing to development, and now manufacturing. The manufacturing is taking some time to get people the doses that they need and they deserve. And yeah, maybe it was oversold at the beginning, but it's coming. So that notion of keeping hope, keeping focused on that future target is really important. But I do want to illustrate the point. The vaccine is not the cure. Just because you may have gotten the vaccination, it does not mean that we are totally safe. It does not mean that we can let down our guard. It does not mean that society comes back to normal instantaneously. The protective strategies that we all have been doing over the last 10 months, those must continue even post-vaccine. So yes, disappointment true, try not to let it get to an anger standpoint. We need to keep vigilant to make sure that the decisions and the distribution is done fairly in a socially justified and equitable manner, that they don't come out in the same way that previous decisions of systemic inequalities and racially tinged decisions have historically. Of course, that must always be what we shine flashlights on. But I don't want people to get also trapped in the notion that the vaccine is the be all and end all, and somehow if that gets disrupted, our cure has been taken away from us, because that's just part of what is going on. The personal connections that all of us have, the reasons that we have, the masks that we must still wear, you got to still do that stuff and take care of yourselves and take care of each other.
That was an excellent kickoff presentation, Dr. Dawe. Appreciate it. And
you guys all take care of yourselves. Take care of each other. Stay safe.
okay. Appreciate it. Thanks for coming out. Appreciate it. And I should add again that the slides will be available for you guys after.